So many people ask, what is CST therapy and how does it work? Well, I'm here to tell you. So few structures have just as much influence over the body's ability to function, just as the brain and the spinal cord that makes up the central nervous system. And few systems have as much impact on the central nervous system as the craniosacral system and the membranes and the fluid that surround and protect and nourish the brain and the spinal cord. So every day that your body endures stress and strains and your structures work to compensate for them, unfortunately, these things and these changes often cause body tissues to tighten and distort the craniosacral system, which can cause tension to form around the brain and the spinal cord. So the result is a barrier to the healthy performance of the central nervous system, and potentially every other system that is working in conjunction is interacting with it, and it's causing it to dysfunction. Fortunately, such as restrictions can detect and correct using simple methods of touch. So I use 5 grams of pressure, roughly the weight of a nickel, and I use my hands to evaluate the craniosacral system by gently feeling various locations of the body to test the ease of motion and rhythm of the cerebrospinal fluid that's pulsating around the brain and the spinal cord. So soft touch techniques, these are then used to release any restrictions around the tissue influencing the craniosacral system. So by normalizing the environment around the brain and the spinal cord and enhancing the body's ability to self-correct, CST therapy is able to alleviate a wide variety of dysfunctions, from chronic pain to stroke, concussions, birth trauma from your baby, neurological impairment, concussion. The list is endless when it comes to craniosacral therapy. So I hope you found this educational, and stay tuned for the next one.